Welcome to Skin Side Out, where we uncover the science, trends, and truths behind skin health. Your trusted guide to the world of dermatology. This podcast is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional.
Welcome to Skin Side Out, where science meets beauty. I'm Dr. Zain, your host, and I'm joined with PA Heather and esthetician Courtney. So today we're talking all about Botox today. Well, technically we should call it neuromodulators. That's the technical term we should be using, but everyone knows Botox. It's kind of like Kleenex. Everyone knows the term. It was the first neurotoxin out there. So whether you hear us call it neuromodulator, neurotoxin, toxin, tox, or Botox, you know what we're referring to.
Yeah, so we're going to dive into what tox is, how it works, the duration, areas to treat, adverse reactions, and potential complications.
And we'll also touch on preventative Botox or tox, and as well as different areas you can treat. Prevention, which is a very hot topic right now. And let's get into it.
I mean, everyone's heard of Botox. It is one of it's probably the most popular aesthetic treatment out in the world. In 2024, there were over 4 million injections in the U.S. alone, which accounts for nearly 43% of all global Botox injections.
I feel like tox is kind of like the gateway drug of the aesthetic world. You know, it's kind of that starting point, and I think it opens the door to other cosmetic procedures.
Absolutely.
Yeah. So what is tox, or what are neuromodulators? They're injectable treatments that temporarily block the signals that go from nerves to muscles, and it blocks acetylcholine. So acetylcholine is responsible for causing that muscle to contract. So if you don't have that acetylcholine, the muscle can't contract, and it kind of results in inactivity, and therefore, there are multiple ways to use this. You can use it to freeze muscles from smoothing fine lines and wrinkles. They can treat migraines, treat your traps for neck pain, so lots of uses.
Yeah, and there's a lot of different kinds of toxins out there. Botox, like you mentioned before, is going to be kind of the most known brand because it's kind of like you mentioned, like the Kleenex of the tox world. But we do have Dysport, we have Xeomin, Daxxify, Jeuveau. So there are different neuromodulators out there. They do all work a little bit differently. So just depending on the patient's goals and what they're looking for, that's when a provider might use one versus the other.
Yeah. And just to clarify, those are cosmetic toxin uses.
Correct.
So those are like, toxins that are available for cosmetic uses. There are medical toxins used for dystonias and spasticity and things like that. So just wanted to clarify that.
Yeah, and I think a big misconception sometimes we get, I know in clinic, is people who want to use Botox medically speaking, let's say for migraines, and they will contact their, injector for that. But if you are needing that, you do have to go through your doctor, your neurologist for that, and you do have to try and fail many different things. So it's best to go to your neurologist to get that treated. So
yeah.
disclaimer.
And interestingly, there is a new toxin out in the pipeline. So Galderma is in a phase 3 trial for a new ready-to-use pre-constituted toxin. And that's exciting. I think that it will probably first get approved in Europe. So we're waiting to see what that's like. That's going to be pretty exciting.
I think that's going to be very interesting, just because I think what a lot of people don't know about tox is that it doesn't come diluted, so we end up diluting it on the back end. And so with that being said, that's, a little scary sometimes, which is why you don't want to go to somewhere that you don't really trust. I mean, some of these like Groupon ads and stuff like that, because you don't know what their dilution is and how
watered down.
Exactly, how watered down it truly is. So it'll be interesting to have that concept come out.
Yeah.
Yeah, so kind of going off of the Galderma new toxin, there are other toxins that Courtney touched on. There's Botox, Dysport, Jeuveau, Xeomin, Daxxify. They're all slightly different, but they're all similar in their kind of base model. So Clostridium botulinum is a bacteria that is found in soil, dust, sediment. It's also found in honey, and that is what creates that botulinum toxin. Like I said, they're kind of slightly different. There are some botulinum toxins that have complexing proteins on them, others do not. Some have other molecules kind of added to it. And so that's kind of the difference in those brands. But kind of going back to the honey, the reason that you don't give honey to infants is because there's this botulinum toxin in honey, which could increase their risk for botulism. So the flaccid muscles, paralysis, it could be very serious.
It's so funny. Culturally, so my family's Pakistani, and back in Asia, a lot of new parents give their newborns honey. There's
Mm.
this part of like customs and traditions, and I'm like the doctor in me just kind of cringes when I hear that, and my wife's a pediatrician, and she like freaks
Yeah.
out about that. So, but it's just funny, just the whole relevance with botulinum toxin
Mhm.
and not giving it to kids.
Yeah.
I
Got
don't
some
advise
smooth,
it.
Yeah.
real smooth baby skin.
Yeah.
That's really preventative.
Yeah.
Yeah, and I know some of the different toxins. I believe it's a Dysport that has the milk protein in there.
Mhm.
So just
Yeah.
looking at things like allergies,
Yeah,
being
and it's
cognizant.
interesting. I actually had a patient who has this,
Mhm.
and I'll never forget. We were injecting her, and then she was just getting these really itchy wheals, like these hives that were developing, and it was just like so bizarre because I've never seen anything like that before. And then, I asked her like, "Do you have any, milk protein allergies or anything like that?" She's like, "Oh yeah, I happen to." I'm like, "Okay."
Yeah, makes sense.
Yep, that's why we learn in residency.
Yeah.
Yeah.
So now I'm really careful about asking all my patients prior to toxin injections, "Hey, do you by chance have a milk protein allergy?" It's rare, but it happens, and I actually saw it happen in front of me.
Yeah, and I think that speaks to also how to kind of determine what tox you will want your injector to use. I mean, like we've mentioned, Botox has been around for a while, but we do see people becoming, resistant to that extra molecule on there. So that's where Xeomin kind of comes in, and we've been using a lot of Xeomin just to help prevent that,
Mhm.
loss of efficacy.
Non-responders.
Exactly.
Yeah, and I am a non-responder. So
Hmm.
just kind of giving you my story, I've been doing tox since I was in residency. I started when I was 26. And we're in residency. The cosmetic companies give us samples to try practicing and training on. And so I naturally use Botox, and the residents, we would all just inject each other, getting familiar with how to use it, how to inject it. And yeah, it worked great for a couple of years. And then I just noticed like, okay, I wasn't getting the same effect anymore. And then eventually, like, okay, I did not respond at all. So we repeated it with another like 50 units in my forehead, still full movement. So that's when I sadly learned that I was a non-responder. And that's due to autoantibodies, usually to the binding proteins on the toxin molecule. So, that is increasingly becoming a phenomenon. We are seeing a lot of patients, oh, like I used to do Botox, but it's not working on me anymore. So sometimes we have to mix and match, try different toxins. They're slightly different molecules, so different properties. So it's a good thing that we have more than one toxin on the market and more of them coming down the pipeline. But just know that it doesn't work on everyone, and just could be your own body and your immune system.
And duration, can vary too, with the different toxins. So, for example, I do feel like the Dysport on myself tends to work a little bit longer, as opposed to, I'm kind of in the same boat with the Botox. I feel like I've kind of hit that non-responding. Xify has come out with
Mhm.
theirs and allegedly is lasting longer. I think they say 6 months.
Yeah, I don't know about that. I mean, it's a great neurotoxin, but essentially we're having to inject double the
Yeah.
amount.
Yeah.
So it's really not adding that much of a benefit if we were to inject equivalent amounts of a different toxin such as Botox or Dysport, things
Yeah.
like that.
Heather, you want to touch on what might affect how long the tox lasts for someone?
Yeah, I think there's a number of reasons why you might need to come in 3 months versus needing to come in 4 or 5 months. Age definitely does play a role.
Hmm.
Your metabolism plays a huge role too.
Hmm.
Depends on how quickly you metabolize that neurotoxin or that tox. Heat can play a role. So if you're in hot environments, especially right after the injections, could play a role. The way that your provider stores the neurotoxin or tox, I think that really plays a role, especially if they are mixing the bottle and then just leaving it out all day. That can play a huge role. Technique, dosing, the area that you're treating. There are a ton of different
Even the depth of
modulators.
the needle, where you're injecting, if you're doing more superficially in the skin or more into the muscle,
Yeah.
we can see differences in duration.
Again, just going back to the dilution aspect, it's really important that you go to these reputable centers because that can really give you the outcome that you don't want, especially if you're spending all that money on it.
Yeah, I
Yeah.
mean,
Get
did you see
lost.
that article about that? I think he was an esthetician.
Mhm.
He was, I guess, getting illegal tox, which was counterfeit,
Mhm.
injecting in multiple people. So, I mean, this
So,
stuff
yeah.
goes on, and you
Yeah.
don't know where they're sourcing it from, whether it's even tox.
Yeah.
So, it's scary.
Yeah. The whole DIY aesthetics Reddit page is like such a jump scare. So let's talk about places where we use tox. We'll start with kind of our on-label areas, which are going to include your glabella. People also call these your 11 lines. So I would scowl, but I don't think it'll make a difference to show you. We treat forehead and then crow's feet, which are around the eye area.
There are other places on the face, though, that you can treat. So lots of areas. I mean, you can do a brow lift. If you scrunch your nose and you get little lines at the tops of your nose or the top of your nose, that's your bunny lines. You can treat that. There's jelly rolls. So jelly rolls are where if you smile and you get this kind of bunching underneath your eye, that's your jelly roll. You can relax that muscle and kind of help smooth out the under eye.
It's actually the same muscle that's creating your crow's feet, and the one that we also inject for brow lift. It's like a circumferential muscle,
Mhm.
The
and then we're just
oculus ala. Wait,
orbicularis,
Orbicular.
oculi. But very good. I'm impressed.
But it can help
Someone studied their anatomy.
Yeah, it can help eyelid twitching too.
Yeah.
There are other areas on the face, the masseter. So that's your large kind of jaw muscle. People who grind their teeth at night definitely notice a difference with that. You can treat your lips. You can do a little lip flip. You can treat like a gummy smile. So if you smile and your lip kind of pulls upwards.
Nasal tip lift.
Yep, your
Mhm.
DAO. So if you feel
Mhm.
like you're kind of downward turned on your when you're just at it resting, if you feel like you're frowning all the time, your chin, dimpling chin,
Peach pit chin.
Yeah.
It's a thing.
yeah, there are lots of great uses for it.
Yeah, and like moving down, like there's also uses that we do in the office off label. I love doing the Nefertiti lift where we're injecting, the platysma muscle, which wraps around our neck and also integrates into the jawline area. So it kind of gets a nice contraction. It also helps with those little rings that we get from tech neck just to smoothen them out. Those platysmal bands, those turkey neck bands. So that can relax those and improve that. Along the lines of like migraine injections, like I do them on my wife, and it really helps her migraines. But there's obviously a lot of injections in the temporalis muscle behind the the scalp and into the neck, into the traps. So you can actually just use traps Botox just to kind of get that swan-like appearance. So that's something that is very popular in Korea, and like women like that slender, elongated neck look. So I think that's really an interesting place to inject. You can also inject other areas, so like your scalp. A lot of women like getting a Botox, where we inject the toxin to reduce sweating, so that they don't have to wash their hair as often. So I mean, it's a practical thing, I guess. There's some other off-label. What other areas?
Hyperhidrosis, which
Yeah.
we talked about earlier. So
Yeah.
that's excessive sweating. So that's a nice option for those people who have tried, oral medication and topical medication. It typically is a lot of injections, so it's not for the faint of heart, I would say, and it can sometimes be a little costly.
Yeah.
But it does do a fantastic job, and patients are usually happy that they've
Yeah,
done it.
and there's like other areas in medicine that we're using toxin.
Yeah.
So interestingly, I have treated patients with vaginismus, which is a painful like tension of the muscle around the vagina in women, and that can cause significant pain, vulvodynia. So we've actually injected Botox in there to relax the muscle, giving them pain relief, and that was really incredible. I did that with my one of my attendings in residency, and it just made such a big difference for them. Like
Mm-hmm.
it reduced pain. It allowed her to have intimate relations with her partner, which she wasn't able to for the past 2 years, and it really did change her life. You can use it for overactive bladder, so that is something that urologists use to really help with that tension. And then strange uses of tox. So men have at times requested scrotox. So as you may think from the name, it's when men want to get injected in their scrotum so that the rugae or the wrinkles of the sac smoothen out. So I guess some people like that look, and tends to make your testicles hang a little lower. So I mean, whatever floats your boat, right?
Yeah.
I feel like there's something for everyone.
Yeah.
There is. And that's the cool thing about tox. Like we're using the toxins property to really make differences, and whatever differences you're looking for, as long as it's safe and effective and done by someone who's professional, who knows what they're doing, I think it's fine.
Yeah, that is definitely not something you would want to go to like someone who is not knowledgeable on anatomy about. I feel like that is something really bad waiting to happen.
Yeah. So there are definitely, the classic ways to inject tox. Let's kind of dive into baby tox and preventive tox. So baby tox or microdosing is another thing that they call it. This is where we're actually using little micro droplets of the tox into a kind of a spread out area. So instead of just injecting, 4 or 5 spots on your forehead, we might sprinkle tiny little dosing all across your forehead, spread it out more. I think that does give a much more natural look, and works very well. Not to just completely, some people do like the completely frozen look, but I think there's definitely a trend towards the microdosing.
Yeah, and I think also what a lot of people don't tend to realize with tox is that you can still have expression. It's more personalized than people would assume. I think people just think either you're frozen or you don't have tox. And there's a lot of ways to decide how natural you want your tox to be. Depending on how it's injected, like Heather had mentioned, just about spreading it more throughout rather than just focusing on one area. I've, worked alongside injectors who tend to just do one or two right here without spreading it out through
Like
this
a big bolus.
big bolus.
Yeah.
And then it's just frozen, but then the rest looks a little unnatural. So,
I mean, when you're looking at the face, you're seeing a culmination of multiple muscles interacting with each other, right? So we're using this toxin to really reduce the movement activity of a muscle. So I definitely can tell when someone has had only one area injected and has left other areas alone. It just looks odd because you don't see the muscles moving, and then the other muscles tend to overcompensate, and you see even more unnatural lines forming. It almost looks better if they didn't do anything than had they just done a little bit more of a natural approach, kind of spreading it out. I think that's a way better look. And, some patients just aren't educated by their injector about that. And that's in part because of their training. So yes, you can go to a weekend course and start injecting tox if you're, a doctor, a nurse, or a PA. But that doesn't mean you're going to be a good injector. And understanding how these muscles intricately work together. And if we're able to kind of look at the whole face as a unit and just making sure that we address the muscles, their movement, and the look that we're trying to achieve and the look that the patient wants, I think we can get a really beautiful result.
Yeah, definitely.
it's like how, we'll have patients sometimes come in that just have forehead lines and they just want to treat those forehead lines. And we tell them, you can't treat this. It's going to drop without treating that glabella region. And people sometimes are a little surprised. And once you kind of explain it to them, I think they understand how it works, but it again, like you said, it will end up looking very weird to just treat sometimes that one area so heavily.
And many times patients come in with horror stories from prior experiences, like
Yeah.
they were treated at a med spa and they got a droop, or it just looked really odd and migration or had other symptoms. And, I think that with the proper education, you can restore their confidence as long as you know what you're talking about. You go in with a plan, do an extensive consult, and educate the patient. I think that, you can achieve good results even after having poor results in the past with other injectors who may not have been as knowledgeable or skillful with injections.
Yeah, I think the consultation makes a big
Huge
difference.
difference. And that's why we spend time with our patients when we're consulting them, especially the newbies. Like, if they never had tox before, like, we
Yeah.
are holding their hands, starting off with more conservative dosing. And I always have my patients come back 2 weeks later
Yeah.
because I'd rather be conservative, because once you inject the tox, you can't undo it.
Yeah.
So, I mean, if you get a bad result, you're going to have to wait about 4 months for it to wear off, for, those results to go away. And I'd rather bring a patient back and add a little bit more as a little touch up. And I think patients also like that because they are feeling comfortable in your hands. You're going slowly, especially if they've never done it before. They feel reassured. And, I think that really helps with restoring confidence.
Yeah, agreed.
Yeah.
So let's touch on preventative tox. I think this is such a controversial subject, and I hate that it's so
I
controversial
don't get it. Yeah.
because I believe in preventative tox.
I
I
believe in it
support
too.
Yeah.
as someone who I don't know, Heather, when you started getting tox. I don't know
I
that you
think
told
I was
us.
27, so around the
Okay.
same
By the
time.
way, everyone, we're all like 60 years old.
Yeah.
Yeah.
Tox.
I also started getting tox maybe around 23. Granted, I did work in a dermatology office, so I think that, I had more access to it for sure,
Mhm.
as well as you did being in the dermatology field. I know you said you've started around that same age. So I think there's nothing wrong with preventative tox, getting a few units here and there just to help keep those lines from forming
Mhm.
will really benefit you in the long run, because I tell patients this all the time. It is so much easier to prevent than it is to correct, especially wrinkles.
Mhm.
Mhm.
So
And remember, these etched lines that we see at rest, these static rhytides, are due to repetitive movements over time. So as we're, in our daily lives expressing ourselves, making those facial expressions, those lines become etched and they are really hard to treat, especially if it's gone on for decades. So I really think that if you can prevent those lines from forming in the first place, or at least keeping them soft, it's a much better result.
Yeah, and the most ideal candidate for this would be, somebody in their 20s or 30s who's kind of like us when we started out, who's really getting into trying to keep those muscles relaxed, keep those
Mhm.
lines from forming and stay smooth.
And I think it also varies on the person. I mean, for example, I didn't start getting my crow's feet done until later. When I started with tox, it really was just glabella. I don't even think I got forehead until recently, maybe, I don't know, 2 or 3 years ago. So
Yeah.
it was more of a gradual
Mhm.
trajectory for me, but it still was a little bit at a time that I feel like helped a lot.
Yeah. And also, let's be mindful of the anatomical difference between men and women.
Hmm.
Yeah.
We have different biological, muscle, patterns, movements. Men tend to have more powerful muscles, so they tend to have deeper lines. It's just part of our anatomy. So we may need a little bit more toxin to achieve the same results compared to women. However, also from a cultural standpoint, there are certain ways we inject to really capture, feminine as well as masculine, as well as fluid ideals.
Hmm.
So it's really what the patient wants. And you can't just assume that they want to look like this way or that way based on their identity. And you really have to ask the patients what they're looking for. Like, I've had, men who really want arched eyebrows, and we can achieve that with tox. And I've had women who really want flat, lower eyebrows, and that's fine. So, using the dosages, looking at muscle patterns, and also looking what they want to look like is really important.
Yeah, so let's get into side effects and potential complications. So I think the most common side effects we see with tox are injection site reaction, maybe some pain, redness, swelling, potential bruising. They do go away after a couple days.
Yeah, occasionally people might get some headaches or on rare occasion flu-like symptoms. If you're getting your tox in the winter, just know it's probably because it's flu and cold season.
Yeah.
Yeah, and then one of the biggest complications we hear about is ptosis, lid ptosis especially. That means when your eyelid droops, and that's due to diffusion of the neurotoxin getting into the levator palpebrae superioris. That's a mouthful. So what this muscle is responsible for doing is kind of raising the eyelid. So with the toxin coming in, inactivating that muscle, it weakens it, so you get that ptosis. So I'm sure you've seen it on social media with some patients who have gotten eyelid ptosis, and it's not a good look. And unfortunately, you really can't do too much about it. There are some eye drops that you can use that help to reverse some of that, activity, but it's still not a home run. But there is something that you can do for that. That's for lid ptosis. And then for brow ptosis, your eyebrows are basically drooped because you have injected either too low in the frontalis muscle, which are the forehead muscles, and that leads to inactivation of that muscle, which normally elevates, and then you got that droop. And that's a pretty common one that we see
Yeah, I would say
at
that's
other
pretty
places.
common.
And unfortunately, when a patient comes in with those complications, coming to see me to reverse it, it's really hard. You usually have to wait it out.
Yeah. Sometimes we'll see the watery eyes or even dry eyes, depending, same thing on kind of where that drooping is coming from. So, and again, just having to wait that out, unfortunately, for the 3-4 months.
And we have some patients who, complain about twitching of their eyelids as well, as a result of it too, and also some issues with vision. So these are all things that are avoidable with proper injection technique.
Yeah, and even like around the mouth, if the toxin is getting into a muscle that you don't want, you could have a crooked smile. That even goes all the way up to when we're treating the crow's feet. There's a risk that you could inject the wrong muscle, and then when you smile, your smile is very uneven. Back to kind of around the mouth, you could potentially have drooling if the wrong muscle is injected. So definitely make sure you're getting the right care.
It's not a good look. I mean, tox around the lips, everyone's talking about it. They love the lip flip, but they don't realize that when we're injecting toxin around the lips, you are weakening the muscles around the lips. So normal functions such as talking,
Eating.
Drinking out of a straw.
Yeah.
I have been there, especially I went through such a year of my life where I would not stop touching my lips, and I literally could not drink out of a straw. There was like times I was like drooling, like it was just misery for like a year straight.
Yeah, it's not a good look. And then also like you can hear the lisp.
Yeah,
Like
the filler lisp,
Yeah.
the tox lisp.
Tox lip. It just doesn't sound right. You don't look right. And it doesn't last that long. I tend to not be a huge fan of lip flips in general.
Yeah.
Like the only ones I really consider are like, younger females who just want a little bit of improvement of their pout, but don't want to do filler. And I just tell them like, I'm going to do a little bit, a sprinkle, very conservative, just to kind of achieve that look. But you're going to be back here in 4 to 8 weeks. It's not going to last very
Yeah,
long.
it does not last long at all.
Yeah, I wanted to mention, not that this was bad injecting at all, but it's making me think about the last time Heather and I did our talks, and we did our DAOs, and I literally could not frown to save my life. Not that I'm like a frowner, but I was in the mirror cracking up because I literally just like couldn't move down.
It was too good of a result.
It was too good. Yeah, I was upward for 3 months just smiling nonstop.
So that's why you're in a good mood. That's
Yeah.
So maybe
That's
we
why
need
we're
more.
back to grumpy Courtney.
Listen, I've been on prednisone. Lastly, we do want to touch on allergic reactions because that can happen. We tend not to see it very often, I would say, but it definitely is a possibility that you do want to be aware of. So things like difficulty swallowing or difficulty breathing, itching, a hive-like reaction. Those are all things that you want to inform your provider about as soon as they happen.
But that's different than botulinism. So, this toxin can, at the wrong doses and high doses, cause issues of muscle paralysis, and that is a serious issue. And some patients freak out because they may be having an allergic reaction,
Mm-hmm.
but they're thinking that it's botulinism
Mm-hmm.
and that they're being poisoned and like they are like having those symptoms. So just be careful. Like some of those symptoms may actually truly be an allergy.
True.
Yeah. So let's talk about some cautions and contraindications for tox. Courtney, do you want to get
Yeah, it's like those commercials, like don't use Botox if you're allergic to Botox.
Yeah.
No, duh.
So obviously, women who are pregnant or breastfeeding, we typically do not want to inject them. Kind of like you were talking about with the infants earlier. Obviously, we don't want to pass that along to any babies.
Yeah. I think you also have to be mindful of people who have neuromuscular disorders, ALS, and MS, so multiple sclerosis and amyotrophic lateral sclerosis. Not very common, but I think those people do know that they shouldn't be coming into the office for
Yeah.
tox.
And of course, like being a cosmetic dermatologist, you see patients who have body dysmorphic disorder. I tend not to touch these patients in general because no matter what you do, they will not be happy and will ask for more or for you to do something else. So I just caution with that because you're never ever going to make these patients happy. And they really need the care of a psychiatrist.
Yeah.
So, what can you expect when you come in for a treatment? So, at least with us, you'll start with a consult where you'll get a good gauge on how many units per area that you will need. Typically, we don't numb for this procedure. Most people don't need numbing. I think it's pretty tolerable. We use insulin needles, so teeny tiny needles to inject the face. And we do use ice to help just with bruising and help numb that area a little bit. Once you've kind of determined what you will need, typically then it will, be drawn up, usually by one of us, not Dr. Husain. No.
I am a diva.
During the procedure, we'll basically have you sit back, relax. Like I said, we'll use a little bit of ice, make sure it's pretty comfortable, and then just start, injecting. Like I said, it's tiny little insulin needles, so most patients tolerate it really well. Some areas can be a little bit more tender. Sometimes doing those lip flips can kind of bring a little tear to your eye, but overall very tolerable. I don't think I've ever had anyone that's tapped out. So
And it's really quick.
yeah.
Mhm.
It's considered a lunchtime procedure for a reason. So you can literally come in and within 10 minutes be treated safely and effectively. And immediately after, you may see some small little, almost like little pinpricks where we injected. That goes away. You might have some mild swelling, goes away in an hour. So, relatively easy in terms of recovery.
The day of your tox appointment, ideally you don't want to have any excessive or aggressive exercise or heat. You also don't want to lay down for 4 hours afterwards. It's also best to kind of use those muscles and be a little bit more intentional and active with those muscle movements. That actually helps the tox kick in a little bit quicker sometimes. So just things that you can do that day of the procedure, but otherwise you're kind of back to normal the next day.
Yeah. And I know that there's been a lot of talk about using zinc supplementation to help extend the
Mm.
duration of your tox. That has been disproven.
Yeah, and there are products out there. I know Revision makes one called Revox. We have a new PTOX from SkinCeuticals that Heather and I have started using. So there are some of these adjunct treatments that you can use that are supposed to kind of elongate your results. I haven't used the Revox frequently enough, but I will say I have been really liking the PTOX from
Yeah.
SkinCeuticals. I
I've been
do feel
using it
like
too.
it's okay. Yeah, I feel like it has been helping. Again, in adjunct to
Yeah.
extend those results.
It's hard to tell.
It's yeah.
But I do feel like my face and my skin looks better with
And
it.
we're always like, oh yeah, I think it's working, but we're doing Lay's MD,
Yeah.
we're doing Tox.
Well, you're yellow half the time because of your moisture.
Don't get me started on that.
We're on the best gauge sometimes, but I like it. Yeah.
Hey, one other thing I wanted to touch on, just from another cool use of neurotoxin. As a surgeon, I'm a Mohs surgeon, so for some patients, especially for like facially cosmetic sensitive areas, you can actually use toxin to help wounds heal better because part of the wound healing process requires some of these neuromuscular, interactions as the scar is contracting. So if you are able to relieve tension around the site, like say on the forehead, of the muscles around it, you're having less tension on the scar, which will help it with healing. So I have done that for a few patients where I've done like cosmetic excisions, some facial cosmetic surgery, even for some of my Mohs patients, and it has helped dramatically with, improving the scar.
Yeah, that makes a huge difference.
I think that's a pretty good chat all about tox.
Yeah, I mean, I
Feel like-
think that a lot of people are afraid of toxin. They think that, it's something scary, especially probably from the word toxin
Yeah,
itself. And I
yeah.
think that's why I prefer the term neuromodulator.
Mhm.
And I think that with the proper education by the right professionals, it is a phenomenal treatment. There is nothing that can do what Botox does.
Oh, yeah.
There is nothing.
My TMJ alone, it has made worlds of difference for me. The quality of life has just been so much improved with tox. It has so many different areas it can treat. And again, I think that for so long we just saw this whole fear of that being frozen look. But again, that's not necessarily what you should be expecting at your appointments. There should be some fluidity with your movements. And again, the customization is up to your provider.
Yeah, well, I disagree with that. I actually think that, patients may like the frozen look and that's what they're looking for. And if that's what your injector's, philosophy and aesthetic is, then that's fine. But I think that for me, I tend to naturally gravitate
That's
to more
fair.
conservative treatment. So
That's fair.
there are some people who like that.
I'm that person. I don't want to move. I don't want to move.
I force you to have some movement because I don't want to look at a frozen person. I don't want you to scare my patients.
I know.
That is why a consultation is super important, so that you know that your views and your goals are the same
Align.
as
They have to
your
align.
provider's.
Like it's a partnership, it's a journey. We
Yeah.
have to work together to achieve that goal. If you are asking for something that's fundamentally different than how I view aesthetics, then it's just it's not a match.
Yeah.
So like I think then there's probably another provider out there for you who can inject you to your liking. But I really want my patients to look refreshed.
Yeah.
I don't want them to look done.
Yeah.
Yeah.
And that's okay if they're, as long as you're seeing someone who, again, is skilled, knows what they're doing, knows the anatomy, and has been properly trained. I think, those are the most important things.
Yeah, and be confident during your consultation. If you have questions or are worried about something, just ask. Your provider should always be happy to answer the questions that you have and make you feel more comfortable during your process.
And take it slow. You don't have to do it all at once. You can take baby steps, and that's totally fine. And it's a journey. So you can do this over multiple sessions. That's not a problem.
Awesome.
All right. Well, I think this was a great discussion. We talked a lot about the different uses for neurotoxin or neuromodulator for aesthetics as well as medical purposes. So it's not just for, wrinkles. There's a lot of clinical applications for tox. We also talked about how important it is for a good consultation, looking at your provider for education and for guidance. And then also how we see innovation in the future, how there is new topical and injectable formulations that are coming out to market. I'm excited to see what the future holds.
Yeah, me too.
Yeah.
So this episode of Skin Side Out was a lot of fun. And I think that a lot of people have questions about Botox and they're scared to ask. So hopefully this was a good, enlightening discussion about it. And if you guys have any questions, feel free to reach out to us. If you like this episode, please subscribe and follow us. Otherwise, till next time, Skin Side out.
Thanks for listening. This episode of Skin Side Out is complete. If you enjoyed today's episode, don't forget to subscribe, rate, and leave a review wherever you listen to your podcasts. For more tips, updates, and behind-the-scenes content, be sure to see what fun we're up to on TikTok. Follow us on Instagram and Facebook at Nor Dermatology and Aesthetics. Check us out online at norderm.com. Discover why our patients give us 5 stars on Google. Call us today at 919-617-0717.